Hello, we're going to talk about the clinical assessment of articulation and phonology today. So CAAP, there are a lot of moving parts going on with this test, not as bad as the PLS, but it does have a lot, so it can seem a little overwhelming. I'm not going to go into detail about every single piece of this test. I just want to kind of go over the basics of it to just give you a quick introduction. So the CAAP does have a manual, just like any other test. It has two protocols, one for articulation, one for phonology. So just making sure that you have that appropriate protocol depending on which one you are testing. It has its nice little easel like most of our tests do. And then it has friends. If you see, we have friends. So these are really kind of cute. And what it does is it's meant to kind of break the ice and to introduce the child to this particular test, just to get them interested. And there is a story that goes along with the friends. And so just so that you are aware, you can use the little friends. You don't have to use the friends if you don't want to, but they are kind of cute and they probably do capture the child's attention. So this particular test can go all the way up to 8 years, 11 months. So it can go up through the school ages, and there actually is a school section. All right, so let's get started. We're gonna move our friends out of the way for now, and let's take a look at the easel. So if you take a look at the easel, here are all of our friends, all their names. So we have Elba, and we have Mac, and we have Paris. Here's Paris. And we have Morty, whoopsie, sorry about Morty, and we have Tara, or Tura. I'm not really sure actually how to pronounce that one. So if you want to leave a comment, let me know how do you actually pronounce that. That'd be great. So you have your friends. We're going to put them away for now, just so you know that. So they are little squishy friends. If you are doing the introductory story, you're gonna set your little easel up just like all of our other tests do. This is what you will see. This is what the child will see. So give them a little view of their picture. So your test will be faced this way. And as is with a lot of our other tests, you are going to read exactly what it tells you to read, and you're going to flip away from you. All right, so you're not recording anything at this point. You are just going through and you're just telling the story. You're giving them the little toys to look at, and you're letting the kid kind of just get familiar with who you are. So no recording at that point. Then once you're ready to start testing, you're going to go to this tab where it says consonant inventory, and you essentially are going to just practice. And what's really great is it tells you right here, practice only, no need to record. So you're not recording anything. You're just gonna flip through. And then here, if you're telling the story, you're doing a great job. And little Elba and Mac are gonna be there, and you can use them as you would like. Okay, then you get started. So here is where you're going to need your articulation inventory. And it looks pretty similar to a lot of our other inventories. So here it is. And you are just going to put a check if it's correct, a dash if it's deleted, an X if it's distorted, and then you're going to put in the correct symbol for any kind of substitution. So your IPA is going to be really important here. And you are just gonna go through the test. You're gonna flip through like this, but the easel will be up, and you're just gonna say, what is this? What is this? What is this? Just like all your other articulation tests. And if the child does not get it correctly, you do have this little prompt here to help to be able to encourage that kid to keep going. So you're going to go through, and what you will see, which is really quite fun with this one, so you'll see lots of questions that you're asking the kid, lots of different prompts to be able to give them, right? You'll come all the way down to here, and what it's going to say to you I apologize, sorry, let me get there, is if you're using your friends, it's gonna say right here, if the child is less than 5, you may stop testing. So you don't have to test anymore, and it's right here on the easel, so you don't have to go looking through the manual for that. So basically, if you're gonna stop there, what you have done is you have all this information for here. You're going to total up the number of errors. So errors go here, errors. You're gonna transfer that to the front of the page. So right here, consonant score. You're gonna pull out your manual. You're going to go to page 87. You're going to find your child's age, just like a lot of our other manuals. And then what you're going to do is you're going to say, okay, what were our errors? We're going to transfer that to standard scores. We've got upper and lower limits and our percentile rank all in one chart. Make sure that you have the right age. For this particular test, you don't have to worry about gender. It does not have it split up for this test, so some people might like that a little bit better. But these are your word error norms. So make sure you're in Word and you have the right age. If you are working with a school age student, so a school age kid, so at ages 5 years and older, then you are going to administer from the tab here, this school age sentences. You have different sentences here. You have a different spot here where you would be marking that. And then in your manual, that is going to start on a different page. It's going to start on page 100. And here it says sentence error norms. So again, making sure that you're double checking that top part. And again, it's going to have your standard score, upper, lower limits, and percentile rank. Use the paper to kind of guide you like that. So if you have 3 errors, you can go across. You can see that's a standard score of 108, so forth, so on. All right, so those are your sentence errors. So it goes all the way up to 811. Remembering that is your top limit for this particular test. If you're looking for your age equivalents, that's going to be on page 107. So that you will put right here, percentile rank, age equivalents, and your confidence intervals. So make sure that you're recording on the front, whether that's the consonants or you're at the school sentences. And remember, again, you are doing the number of errors, and always keep in mind that you're taking into account differences in dialect and our English language learners, that you're not counting things wrong if it's just a difference. If it's dialectical, we need to make sure that we're taking that into account. So if you are not sure what those are, if you know that your child has some kind of other influence, you need to do your due diligence and make sure you figure out what those differences are. All right, let's move into the phonological processes. So there's 2 ways that this test allows you to do that. So checklist number 1, you're just going to open it straight up. You're going to work on this page and this page, so don't open it fully. You want to check at the top. It says checklist number 1. So for checklist number 1, all you have to do is get your information from your articulation inventory. You'll come in here, get all the information from here, and you're just going to answer these questions. So in this particular one, did the child have final consonant deletion? Yes or no? And you're going to answer that for every single one after you've administered the test. Okay, so pretty easy. That's how you're going to administer that one, and then you can just transfer that to the front of the testing protocol. All right. If you decide you want to do the second approach, you're going to come to your easel. All right. You're going to go to Phonological Probes, this tab right here. And again, your directions are right here for you, which is super great. So you're going to tell the kid that we're going to look at some pictures that you've already seen, a few of the pictures on each page. Let's get started. You're going to flip away from yourself. This time the child sees 2 to 4 pictures, and you're targeting very specific processes here. And it's going to tell you that right here on your easel. It tells you that you are looking for final consonant deletion. All right. So you are going to say to the kid, what is this? You're going to point to the picture while you're doing it. My kind of suggestion to you is that you test on an angle so that you are sitting like this. Your protocol is here. You're sitting at an angle so that you can point with your non-dominant hand and record with your dominant hand. That's going to be just a little trick of the trade I've learned over the years, to sit on an angle when you need to see the pictures as well. If that is the one that you are choosing to do, then you are going to open up the protocol, and then you're going to open it up again. So now you will see you have checklist 2. And in checklist 2, now you're going to be going through those particular, well, the multiple choice. And then you're going to be, what was the response that the child gave? And then does it fall under final consonant deletion, gliding, fronting, or whatever that might be. So 2 different ways that you can administer that particular way of looking at phonological processes. Just remember, checklist 1 is here. Checklist 2 is here. You'll take all that information and you're gonna pop it on the front. So hopefully that helped. Hopefully just a quick overview of how to do the CAAP. Obviously, as always, you want to make sure that you're reading the manual, and if you have any kids who do anything they're a little odd, you're not super sure what to do, always double check the manual.